So on today's edition of Medical Monday, we're continuing with our discussion about warm weather precautions when you're in the great outdoors, as we're sure to be as the weather warms up. You can download the full document at replacingrisk.com in the resources section. Today we're going to talk about heat exhaustion and heat stroke. These things are very serious, very significant, and sometimes you'll see signs of dehydration first before a person has this, but we always need to be aware. One of the best ways to reduce the incidence of heat exhaustion and heat stroke is to keep a person hydrated and not be overexposed to too much heat or too much sun. You can sometimes help keep a person a little cooler by freezing damp towels and just putting them around the person's neck. Light-colored clothing absorbs less light and is actually cooler than dark-colored clothing. So those are a few things that you can do. Always be aware of a person's medications. Some medications like antipsychotics and antidepressants and some antibiotics and blood pressure medicines can affect the way that your body gets rid of heat, which means if you're not getting rid of heat as well as you should, you're at increased risk for heat exhaustion and heat stroke. So what is heat exhaustion? Some of the signs you might see are a person becoming a little nauseated or lightheaded or being very fatigued or tired. You might see muscle cramps as it gets more severe and dizziness. Now, that can progress to heat stroke. There you might see headache. The person might become confused or more disoriented. They might quit sweating because they've run out of fluids. Their heart rate might be beating very rapid. They can have nausea and vomiting. They can lose consciousness, and their body temperature can go very high. That is a true medical emergency. All of those things associated with heat stroke, and you need to call 911 if you should see these types of things. Also, when you see any of these signs, have the person lie down, put them in a shady or cooler area, maybe even an air-conditioned room or an air-conditioned vehicle. Remove any tight clothing that you might see. Wipe any exposed areas of skin with a cool cloth to help reduce body temperature. And, your first thought might be to give fluids, and if the person can safely drink them, you should. But if the person is in a different state of consciousness and they're not able to safely swallow, it's not best to recommend fluids. But anyway, if you see any of these significant signs, you've got to call 911 immediately. So again, you can download the document at replacingrisk.com, and we'll talk about general safety conditions in our next edition.